Greetings, and thanks for taking a quick look at some ideas that could even be life-saving for Gila County residents. What we're talking about today is not theoretical. It's not a paper exercise. This is about what happens when the fire is real, when roads are limited, when communications start failing, and people need help immediately. What we're proposing is a practical, scalable, and locally driven system to protect lives across Gila County, especially our most vulnerable residents. Our purpose is simple: protect life, protect critical infrastructure, and make sure no one falls through the cracks during an evacuation. That means building a system that reaches first responders and medical providers, accounts for home health care and oxygen-dependent patients, and works even when traditional systems start to fail. This is about speed, coordination, and redundancy. Now, Gila County presents a unique challenge. We're dealing with wildfire as the primary threat, rugged terrain and limited access routes, highly distributed rural population, and most importantly, a significant number of elderly residents, seasonal residents, off-grid homes, and medically dependent individuals. And with over 95% of land federally or state managed, coordination becomes critical. This is not a standard evacuation environment. Now, we're not reinventing command structure, we're just strengthening it. This builds on the incident command system, but introduces something critical: a dedicated medical coordination branch. That includes hospital liaison, home healthcare coordination, and real-time patient awareness. Because right now, that piece is fragmented. And in an evacuation, fragmentation costs time, and time can cost lives. Now, this is one of the biggest gaps. No single system is enough. We need layered, redundant communication, including wireless alerts, reverse 911, local radio, of course, including KRIM and Tonto-TV, satellite-based systems for off-grid residents, and most importantly, a direct alert pathway to healthcare providers so that hospice knows immediately, home health knows immediately, and oxygen-dependent patients are not missed. We must know who needs help before the emergency. That means building a voluntary registry system for access and functional needs, and pairing that with GIS mapping, utility indicators, and healthcare provider coordination. This allows responders to prioritize evacuations intelligently and deploy resources where they matter most. No guessing. Evacuation must start earlier than we traditionally think. The set stage is where lives are saved, not go. We define Tier 1 bedridden, life-dependent, Tier 2 mobility limited, and Tier 3 general population. And we pre-stage transportation assets, including ambulances, ADA vehicles, and community transport, because if you wait, emergency services may not be able to get to you. Now, this is where the plan becomes powerful. We move from top-down response only to community-enabled response. That includes micro-neighborhood zones, block coordinators, adopt a neighbor program, and equipping communities with radios, check-in points, and basic response training. All that because neighbors are often the first line of help before responders can arrive. It's important to note that technology is not the solution, but it is a force multiplier. We integrate satellite communications, radio networks, cellular alerts, real-time data feeds, and drone reconnaissance, all tied together with GIS mapping and live situational awareness. So decision makers are not reacting blindly, they're operating with real-time visibility. Now, this is not a long-term someday plan. This is actionable. And we break it into phases. Phase 1 assesses the plan. Phase 2 builds and integrates the plan. Phase 3, train and prepare. Phase 4, test and validate. And Phase 5, operate and improve. Within 24 months, this system can be fully operational. And it scales based on resources and participation. Well, none of this works without strong partnerships. This effort requires emergency management, fire and law, medical providers, community organizations, media coordination, and most importantly, clear communication channels, known points of contact, and defining roles before an incident, not during it. And the final takeaways, at the end of the day, this comes down to just a few things. Early action saves lives. Communication must be redundant. Vulnerable populations must be identified ahead of time, and communities must be part of the solution. This is not about adding complexity. This is about removing uncertainty and building a system that works when everything else starts to break down. Together, we can build a system that protects lives, strengthens this county, and ensures that no one is left behind.